Welcome to your employee benefits overview video provided by 208 Benefits. The information provided in this video is to help you understand your benefit options, pricing, and how to complete your benefit elections prior to your benefit eligible date. Please watch or share this video with anyone that helps you make your employee benefit decisions for you and your family. You can refer back to this video anytime. First, we'll walk you through the presentation deck and then switch over and walk you through the features of your benefit information website. The Alley Heating and Cooling Employee Benefits Package Review. Your benefits package plan year is June 1st through May 31st each year. So the benefits we'll speak about today are based on this time frame. Your benefit website address is shown here. Please take a moment, pause the video, take a screenshot of this, write it down. We do recommend that you add this to your mobile devices, your home laptops, tablets, etc., and share it with your spouse or other benefit decision makers. They have access to the benefit website at any time throughout the plan year. Alley Heating and Cooling offers a comprehensive benefit package that includes the following benefits: medical insurance with telehealth, short-term disability, otherwise known as your paycheck protection, term life insurance, accidental injury insurance, and dental and vision. Your medical insurance plan, it was with the insurer Trustmark. Trustmark allows you to choose any doctor, clinic, or hospital that makes sense for you as far as convenience or preferred provider. Medical insurance terms you should know. First, copay. Copay is the dollar amount that you pay for medical services such as a doctor's visit or a prescription. It's a fixed dollar amount. The insurer covers the rest of the cost. The deductible. The deductible is amounts that you pay for eligible medical services that are not otherwise covered by a copay or otherwise covered as what we call a preventive wellness exam. Coinsurance. Once you've met your plan deductible, any medical expense that you have afterwards is also shared by the insurer. They pay a certain percentage, then you pay a certain percentage. Out-of-pocket maximum. This is the total that you pay for all eligible medical services in the benefit plan year. This includes your deductibles, co-pays paid after your deductibles, access fees, and coinsurance. So your plan summary is as follows. Your plan year deductible is $750. Your coinsurance is 50%, and your out-of-pocket maximum is $6,350. The copays in this plan are listed here. You have a $45 copay for your primary and specialist doctor's visits. For your therapies, urgent care center is an $80 copay. Your clinical preventive services, there is a $0 copay, meaning that is covered in full by the insurer. Prescriptions, you'll see here, generic, preferred brand. Then there is a separate prescription deductible for non-preferred brand and specialty prescriptions. Emergency room visit also has a copay. Advanced outpatient imaging has coinsurance. Outpatient diagnostic lab and x-ray is covered up to $1,000. The only difference in your plan when it comes to your regular deductible is when you have an inpatient hospital admission or an outpatient surgery. Your deductibles does not apply. There is a $2,000 access fee, and this does apply to your plan out-of-pocket maximum for the benefit plan year. Please review your benefit summary for additional information on the access fee or contact 208 Benefits for more information. Included in your medical plan is virtual healthcare, sometimes referred to as telehealth. Teladoc is the provider of this telehealth feature inside your medical insurance plan. Once you've enrolled in your medical insurance plan and you've received your subscriber number, you can then also access Teladoc by registering with Teladoc. Teladoc allows you to talk to a doctor via your smartphone, tablet, laptop, computer, 24/7 by video chat from anywhere that you're able. These doctors are board certified, they're licensed to practice in the state you're connecting from, and they can diagnose, treat, and prescribe medications for common illnesses. Here's some reasons that people visit the ER and other reasons that people would access doctor's care for non-emergency conditions. Allergies, strep throat, respiratory infections, UTIs, earaches, nasal congestion, flus, coughs, colds, sunburns, stomach issues. These are all non-emergency conditions that can be effectively dealt with via Teladoc services. And the best news for you is that there's a $0 fee for using virtual physician visit. So these doctors, again, can diagnose, treat, prescribe medications for you, and you pay $0 to access these doctors. Your benefit pricing is shown here. This is all pricing per paycheck, and these are pre-tax deductions, meaning that the dollar amount you see here, depending on the tier of coverage that you're enrolling, is deducted from your paycheck before taxes are taken. Therefore, there is lower pay to tax. Therefore, you pay lower taxes. Prescription savings plan. This is also separate from your medical insurance plan and can be used for anybody in your entire family. We have a partner called CleverRx that allows us to help you save up to 80% off your prescription drug costs. So how do you utilize and take advantage of the savings is to download the mobile app, enter our specific group and ID number to give you those exclusive savings. Once you've done so, you can simply type or speak the prescription name into the app. Let it search for the pharmacies nearest you for savings. You choose the pharmacy based on your convenience, savings, or your preferred pharmacy. Present the savings voucher that's right on the app, or you can text message it, or you can email it to a family member if they're the ones picking up the prescription, and then present that to the pharmacy clerk, and they can help you take advantage of the lower costs. 40% of generic prescriptions, as an example, are less than $10. This is less than the generic prescription copay on your medical insurance plan that's offered. So please, our advice is check with the mobile app first so that you don't overpay for your prescriptions. Your next benefit that we'll review is your accidental injury insurance benefit by a surety. Now, this is a cash benefit plan, meaning that if you have an injury and seek medical treatment, you can submit a claim and receive cash benefits for that medical treatment. This is 24/7 on and off the job coverage. It pays its benefits regardless of any other insurance coverage, and you can add your spouse and dependent children to your plan. I'm going to show you two examples of how the accident policy would benefit you. If you were to have a lower leg injury, as an example, something minor, and you had a doctor's visit, they performed an x-ray, and then provided you crutches, these are the dollar amounts that you're eligible to receive under the policy, which would be a total of $550 sent directly to you via direct deposit or check, and then you can use that money how you see fit. Example 2, more of a major injury where there's a motor vehicle accident, ground ambulance is part of the treatment, ER visit, MRI, surgery, a couple days in the hospital, walking boot, physical therapy. As you can see, well over $4,000 payable for this particular type of benefit if those are the medical services that you or anybody covered under your policy would receive. How it works, very simple. Obviously, receive treatment for your injury. Submit the claim to a surety. We'll show you how to do that on the benefit website. And obviously, 3, get paid. Put that money to use however you need to put it to use, whether it's offsetting medical expenses, taking care of your everyday living expenses. Cost per paycheck is also listed here, just under $6 a paycheck for an employee and just over $15 a paycheck for an entire family. Your next benefit is short-term disability insurance. Again, we refer to this as income protection. So what we're able to do is help you protect your income if you're unable to work because of an off-the-job injury, an illness, or maternity event. How the benefits work: it's going to replace 60% of your gross monthly earnings in a weekly benefit. There is a benefit deductible, basically meaning the first 14 calendar days you are covering yourself, and then your benefits begin on the 15th day of disability moving forward, up to a maximum of 11 weeks per disability event. Giving you an example of how this would work using average employee weekly disability benefit. If you were ill and unable to work for about 5 weeks, you would receive over $1,500 in disability benefit. If you had an injury, as an example, and you're out of work for 9 weeks because of that injury, then you would receive over a $3,500 disability benefit. And again, this is based on the average weekly disability benefit that is eligible for employees of Alley Heating and Cooling. Your specific benefit may be higher or lower than the average. Maternity works a little bit different in the sense that it pays a lump sum versus a weekly benefit, and it also has a maximum benefit period of 6 weeks for a normal delivery. Using the average benefit payable, you would see over $2,000 lump sum benefit. If there is a C-section delivery, the policy pays out to a maximum benefit period of 8 weeks, and therefore you would receive a higher income benefit. Example pricing. Everybody's pricing is a little bit different. It's based on your age and your income, but the average is a person at 31 years old who earns about $21 an hour, and that rate for that disability protection would be $4.54 a paycheck. Again, your specific disability benefit amount and the cost to protect that benefit amount will depend on your age and your income. Term life insurance. This is your ability to purchase term life insurance through your employer versus purchasing it through an individual basis. Employees of Alley Heating and Cooling can purchase up to $50,000 in term life insurance for themselves, up to $25,000 for their spouse, and $10,000 benefit per child. Now, to note on the spouse, you can cover up to 50% of your coverage. So to get the $25,000, you would have to elect $50,000 yourself. And on the child basis, it requires that you, as the employee, elect a minimum of $20,000 for yourself to have the $10,000 per child benefit. Again, we're looking at some average costs. So an average employee age of 31, if you were to choose $100,000 in coverage, the rate per paycheck would be basically $7.80. Dental insurance, also through Principal. Principal has a vast dental insurance network. There's over 600 in-network providers within 15 miles of Alley Heating and Cooling. Your benefit summary is as follows. An annual benefit maximum of $1,000 per member enrolled. So that would mean if you had a family of 5, you, your spouse, and 3 children were enrolled, everybody receives $1,000 benefit maximum per calendar year. For preventive services, that is covered at 100%. That includes your routine exams, cleanings, and x-rays. That is also deducted from your $1,000 per member enrolled, so just make sure that you're aware that it'll take away from your overall maximum benefit for preventive services as well as other services. For other services, you have a $50 annual deductible per member, or a maximum of $150 per family. And that would include basic services, which is your fillings and sealants, root canals, extractions, oral surgery. After the $50 deductible, the insurer covers 80%, you pay 20%. Again, for major services, which would include crowns, bridges, dentures, after deductible, you pay 50%, the insurer pays 50%. Your rate per paycheck for dental insurance, very affordable plan, just under $13 a paycheck for you, the employee, and just under $40 a paycheck for your entire family. Vision insurance, also with Principal, using the VSP network, which allows you to see many in-network independent eye doctors and top optical retailers, including Pearl Vision, VisionWorks, Intermountain Eye Center. Iconic is the online retailer that you can utilize to purchase contacts, frames, lenses. Your plan summary is as follows. You pay $10 eye exam. You pay a $25 copay for your lenses. They provide you a $150 frame allowance and then provide you a discount off anything above $150. You have additional lens options, copays and discounts for UV treatment, tinting, scratch coating, etc. Your benefit frequency is every 12 months based on your initial access date. So if you were to enroll on August 1st as an example, and you access your benefit on October 12th, then you could re-access your benefits again October 12th the following year. Your vision insurance premiums are very low as well, just over $3 a paycheck for the employee, just under $10 a paycheck for the whole family. Next steps. So we want to review your new benefit information. We have a specific website for that. Contact 2A Benefits with any questions to help you understand your benefits in further detail, but also to assist you with your benefit elections and your enrollment procedures. Complete your online benefit elections. So here is your benefit website. Obviously you're here watching the video, but we want to further explain how to utilize the benefit website so that you can take the best advantage of it, learn more about your benefits, but also have the information available to you at the time that you need it. So as you scroll down here, you will see your View Benefits Information tab, where you see the tiles that illustrate your specific benefits. So when you click on a benefit tile, you will see information regarding this specific benefit. So that you'll see your insurer name, the group number that's attached to your employer policy, the account login, phone number, email address, a video, your benefit summary, PDF, claims, balance bill protection, other videos that will help you save money and understand how to navigate your health insurance, explanation of benefits and expenses, plus mobile apps allow you to download to help you access the insurer directly. Same thing with telehealth, your prescription drug plan, your accident plan here shows you the video about the benefit, again, your group number, all the contact information, your benefit summary, and then how to print your claim form to submit to the insurer so that you can get those cash benefits. Your dental insurance tile as an example, again, a video discussing how dental insurance works, your specific benefit summary, then a provider search link here that you can click on to say, hey, I need to find a dentist that's in network. Search in your zip code area. and we're going to give some results within 10 miles. As you see, there are 494 in-network dentists. Gives you a map that you can look at here and expand, and then there starts to list the dentists that are available in your network. It even tells you if they're accepting new patients, which is very helpful. Back to the benefit tile, you can always log in, insurer number, your group number, just in case you forget your dental card. You can always provide your dentist your group number and obviously your personal information so they can access you and submit the claims correctly. Your benefit pricing, as we listed in the slide deck, that information is also listed here. So you have this accessible 24/7. So as you're considering your benefit options, you can see that pricing here as well. Now, when it comes to enrolling in your benefits, which is obviously the next step, it needs to be done by the 15th of the month prior to your benefit start date. You would simply come here, follow these simple instructions. Here's the video right here that actually shows you how to enroll. So if we go here, you'll see where you create your password so that you can log in. Your email address is your username. You'll see here, it's your start enrollment. So you'll click on the start enrollment button. You'll go and add or update your personal information to make sure it's all correct. Want to make sure that you add your dependents. Even if you are not enrolling any specific dependent on any of the available coverage, please add them to the platform so that their information is on the waiver forms. This is a requirement from the insurers. So you'll move forward, you'll get any notices, you'll sign any notices, and then you'll be able to select your benefits. As you select your benefits, you'll see that you have a green check mark or a red X to waive. Then in certain situations, you'll want to provide a waiver reason. As you review your benefits, you'll see that you have options in some of your benefits, and then you'll simply click. As you do that, your shopping cart on the side over here will simply populate to let you know exactly what is coming out of each paycheck for the benefits that you're electing. As you move forward, you'll input your beneficiaries information. This is very important, and these can be changed at any time. You'll see your benefits summary once you've elected all of your benefits. You are not finished here. You may print out your summary, review, but you do need to continue forward to sign your forms, which is pretty simple. Type in and then scribble in your name, and then it'll apply to the green boxes that you see here that it will populate those forms for you. Once you're finished, and it says 100% complete, you can put in any information that you'd like to, provide a star rating on the experience. Hopefully it's 5 stars. And then at the top, go ahead and click finish, and you'll be done with your benefit elections. Okay, so again, once you reviewed that benefit video, you simply go to your enrollment platform, click confirm. It'll take you directly to the AlleyH Heating and Cooling. Your username is your email address. So once you've first moved in here, or if you forgot your password, simply click in your email address and click submit, and it's going to send that to your email. The email will have a link that you can create your password, and then you will log in as the video outlined. So moving forward, that is how you complete your benefit elections. That's your benefit website to help you review all your benefits. Again, your enrollment deadline is the 15th of the month before your benefit start date. This helps us get the information to the insurers on time, so at the first of the month you're active in the systems and you're ready to go to access your benefits. Thank you from 208 Benefits.